Hello everyone, today's video is another Q&A video talking today about blastocystis hominis, talking about methylene blue and serotonin syndrome, and talking about styes. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a moment to some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. As you can tell, still working from home. Family members still in the hospital, hopefully going to be back home within the next week or two. So yeah, really glad they're getting better every day, and hence still casual aware version of Dr. Raid. So first questions here, there's a couple of questions here about blastocystis hominis. So it says here, what do you think is the ultimate cause? Oh, wait a minute, that's the sty one. It's posted on the blastocystis video. And anyways, okay, here we go. Try again here. Can blastocystis be fully cured with cell core parasite cleanse? My Lyme-Lytic medical doctor told me to do it. And then there was a follow-up comment there on that question that said, I'm curious too. My doc had me on Alinea and another I wonder how ivermectin works as well. So Alinea, also known as nitazoxanide, is an antiparasitic for folks' reference, and as is ivermectin. So thanks for the questions. So in my experience, blastocystis hominis can be resolved as best as we can tell. As I've said in a number of other videos talking about parasites, including blastocystis hominis, we know from the research literature that the efficacy/accuracy of testing for parasites is abysmally bad for at least many of the parasites that have been where they've actually done studies looking at the sensitivity and specificity of those tests. Specificity is quite good, so like not really going to get a lot of false positives, but the false and negative rate is really high for a lot of the common parasites that are out there. So it's the type of thing where if we do a stool test and we find blastocystis hominis, and then we treat, and then we get a test back and it comes back negative, was that because it's actually gone, or is that because the test just didn't pick it up that time? I haven't been able to find any definitive literature on how sensitive stool testing is for blastocystis hominis. And so I don't know what the exact numbers are, but for certain other parasites, like say Giardia, for example, it's like a 42% sensitivity. Like it's quite low to my understanding. So that is just something we have to bear in mind. So what I really base it on more so is how are patients feeling. So if we do a stool test and we find B. hominis, just hard to say blastocystis all the time, so I'm just going to say B. hominis for short. And then we start treating and the patient feels better and we stop treatment and the symptoms don't come back. To me, I consider that to be a cure or a resolution or whatever you want to call it. If we do a retest and we find that there's still B. hominis, even if there's no symptoms left, then fair enough. Like, maybe that's something we want to treat. There's some debate as to what extent B. hominis is actually just a normal part of the ecosystem in the human gut for some people. So like maybe it's not pathological/pathogenic in some folks. So there's a lot of unanswered questions around B. hominis. However, I've had many patients over time who have tested positive for B. hominis, and we treat them with natural products and their symptoms go away and they don't come back when they come off the treatment, and they have follow-up stool tests where they don't have any B. hominis left. So I feel that the natural products can work well. So with that as a backdrop, can the cell core products work in that regard? And I would say probably yes. I mean, I don't use cell core products in my practice. I have nothing against them. I think they're wonderful formulas. I don't agree with, like, I wouldn't, if I was to make up my own product line, I wouldn't completely copy the cell core formulas, in that there's some things that they have in their formulas that I'm like, I'm not really sure how important that is. But by and large, I think they're good products. Quite frankly, I probably would use them, or like, I would prescribe them myself, but just the price point's pretty high. Again, nothing against the company by my saying that. It's also extra expensive for us poor beleaguered Canadians, because our Canadian dollar is not very strong compared to the American dollar. So everything's like literally 50% more expensive, give or take, when we buy some, maybe not 50%, maybe 30, I think 40% right now, actually more expensive. So, that $60 bottle of Cellcore product is going to be an extra, like whatever. Oh my gosh, I shouldn't be doing math on the fly here, but I think like $84 or something like that Canadian. So anyways, everything's a lot more expensive when we buy things in US dollars. So I don't prescribe it because of the cost, but I think they're good formulas. So the herbs that they have in their various formulas are akin to what I would use in practice. Things like black walnut and wormwood and things like that. Mimosa pudica, which is like a shining star of any anti-parasite protocol in my experience. So I think that there's no reason to suspect that that wouldn't work just as well as the things that I use in practice. As far as ivermectin and Alinea go for treating blastocystis hominis, I wish I had more experience with that. We're not able to prescribe those agents here in Canada, like as naturopathic doctors. So I don't know. If I had access to them, I would definitely use them on the regular, because for my colleagues what I've learned from my colleagues who are able to access those easily in other, in the States and other parts of the world, maybe, I think that they're wonderful, wonderful drugs as far as I can tell. And I would use them all the time, but I really don't know how well they work, but I'd imagine they probably work pretty darn well. So next question here, it says, what do you think is the ultimate cause behind eye styes? A bacteria, question mark. When my immune system is low, I would get them every other month and they last for a couple of weeks. So painful. It's getting better now and much less often as I'm healing. So yeah, great question. I'm sorry to hear about that. I'm glad that it's getting better. They're really uncomfortable, as I understand. What I've seen in practice, at least, and bearing in mind, like I have seen like, a few dozen cases of eye styes in my practice, but I'm not like a stye specialist. Haven't helped a stye specialist out there. It'd be quite the job to have. I'm sure they're out there. But anyways, what I've seen in my practice is using topical silver has been really helpful in many cases, and like just ACS 200 silver spray. That's what I typically recommend for my patients. They keep their eye closed and, spray it on, a few times a day or whatnot, let it dry, just because we don't want to spray it like right in the eye. It's probably pretty uncomfortable. And I found that to be really helpful in a majority of cases. Now, how's silver working? Well, it's an antimicrobial. So maybe it is ultimately treating a bacteria or something like that. But in those patients, if they're having recurring, like it was just a one-off eye stye, we just kind of spray it, goes away, and not immediately, but like over the span of a few days or a week or whatever it is, and then they're off to the races. In patients who have recurring styes, in those cases, I think the main issue for them, in my experience, has been probably related to lymphatic system congestion. So we'll be doing something called targeted dry skin brushing, which I believe I've talked about in some other videos. If not, I'm happy to do another one. And maybe some topical like herbs or different formulas to, topically over the local lymph nodes just to help promote some lymph drainage. Heat packs can help with that. Maybe castor oil compresses, things like that, just to kind of get the lymph draining more. Because at the end of the day, it seems that there's a backlog of lymph, then we're going to see things like that pop up. And it might be that, they have styes and they have their lymph nodes are swollen, or they're getting ear infections or ear pressure, or head pressure, or their sinuses are congested, and just kind of seems like maybe from here up, from the neck up, they're just things are just not excreting. Things are not draining down beyond the neck back into the lymphatic system, or down into the circulatory system from the lymphatic system as they should be. So I think if I had to pick one like main cause, I would say that with recurring styes, it's a lymph congestion in my experience, but there could be a local bacterial thing happening there too. I don't know enough about the pathophysiology of styes. Again, I don't specialize in that by any stretch, but just that's what I've seen in my practice. So I'll leave it there for now, but any follow-up questions on that, I'm happy to answer. And then just the last one here. So yeah, on my video that was from a year ago, called Methylene Blue Q&A, tyrosine, ADHD, GABA, topical methylene blue, etc. Someone had recently posted a question, or a comment, I guess, just kind of about, it's quite long. It's worth reading if you're interested in this. I think it was very thoughtful and everything, and I think it's very accurate, actually. But this person was basically saying that they're paraphrasing here, it's quite long, but that they are saying that maybe the whole serotonin syndrome thing is like a little overblown. That's probably pretty hard for that to happen. And so anyways, I only have a minute or so left here on my video time. So I very much agree with what this individual typed out there. That like my understanding of it is that with oral agents that we might work with, like 5-HTP and things like that, it's probably pretty hard to induce serotonin syndrome when combined with methylene blue, as they're saying, and I agree too, that it doesn't mean we want to downplay the risk of serotonin syndrome. I think we want to be really careful with that, but I do agree that having learned from folks who are experts in methylene blue, I think it is pretty hard to induce that. I don't think we have to like tiptoe around methylene blue and serotonin syndrome, but it is something we still want to be really mindful about. So anyways, I'll leave it there for now. I hope this was of interest. Any other questions, just post it in the comment section below.